What is a normal liver function test, LFT, range? Imagine your liver as a busy factory working tirelessly to keep your body running smoothly. To check how well this factory is doing, doctors use blood tests called liver function tests. These tests measure various enzymes, proteins, and substances that tell us about your liver's health. But what exactly are considered normal values? Let's explore that. First, there is the enzyme called alanine transaminase, or ALT. In healthy people, ALT levels usually fall between 7 and 56 units per liter. Since ALT is mainly found in the liver, higher levels can suggest liver cell injury or inflammation. Next, we have aspartate aminotransferase, or AST, which typically ranges from 5 to 48 units per liter. AST is found in the liver and other tissues, so elevated levels might indicate liver damage but are less specific than ALT. Another important component is alkaline phosphatase, or ALP. Normal ALP levels are generally between 40 and 129 units per liter. ALP is linked to the bile ducts, and higher levels may point to bile duct obstruction or liver disease. Then there is gamma-glutamyl transferase, or GGT, with normal values from 8 to 61 units per liter. GGT helps identify bile duct problems or liver damage as well. The liver also produces proteins like albumin, which normally ranges from 3.5 to 5.0 grams per deciliter. Low albumin levels can suggest that the liver isn't making enough protein, often due to liver impairment. Total protein, measuring all blood proteins, usually falls between 6.3 and 7.9 grams per deciliter. This gives a broad picture of the liver's ability to produce proteins. Bilirubin is another key substance, with normal levels from 0.1 to 1.2 milligrams per deciliter. Bilirubin is a waste product from red blood cell breakdown processed by the liver. When bilirubin levels are high, it can cause jaundice, which is a yellowing of the skin and eyes. Prothrombin time, or PT, normally ranges from 9.4 to 12.5 seconds. Since the liver produces clotting factors, a longer PT can mean the liver isn't making enough of these proteins, affecting blood clotting. Lastly, lactate dehydrogenase, or LD, usually measures between 122 and 222 units per liter. LD is released during tissue damage, including injury to the liver. It's important to remember that these ranges can vary slightly depending on the laboratory and the population tested. Also, interpreting these results isn't just about looking at one number. Doctors consider the whole picture, including symptoms and other tests, to understand what's happening in your liver. In cases of liver disease or liver cancer, abnormal LFT results might show injury to liver cells, blockages in bile flow, or reduced ability of the liver to produce essential proteins. Conditions like hepatitis, cirrhosis, fatty liver disease, or tumors can influence these test results. Monitoring these levels over time helps doctors see if a condition is getting better or worse and how well treatments are working. It's crucial to remember that normal liver function test results do not always mean your liver is perfectly healthy. Sometimes, early or mild liver issues might not show up in these tests. If your results are abnormal, it's essential to follow up with a healthcare professional who can perform further evaluations and recommend appropriate care. Always seek personalized medical advice for diagnosis and treatment.